Hi, my name is Fahdel Kaboub, and it's my pleasure to contribute this short video to this wonderful event. My purpose today is to simply provide an economic policy framework, modern monetary theory, to explain how we pay for all the major national priorities, not just a healthcare system, but a federal job guarantee, universal public services of all kinds. And the key message that I want to deliver here is that this is something that the federal government can do, and this is something that states, municipalities, local government offices cannot finance. They can logistically organize the delivery of these services, but they can't have the finances necessary, but the federal government does. So what is MMT? How do we pay for all of these national priorities? And the starting point here is that we can afford all of these national priorities. And I always want to think of these national priorities that we can afford in the US. We can pay for all these things without bankrupting the country, without causing inflation, without any of the scare mongering, fear mongering that you frequently hear about Medicare for all or any of these universal services. So the first thing we need to deliver is universal public services, green infrastructure, Medicare for all, housing for all, education for all, childcare. All of these things, we can afford them without causing inflation, without bankrupting the country. Number two, this is the second layer of public policy, a federal job guarantee with decent wages and benefits for anybody who's ready, willing, and able to work. So this is for people who actually want to work and can't find decent employment in the private sector. The third layer of this public policy system is a generous income support system for people who can't work or shouldn't work for health reasons and other reasons. So think of it as a three-layered cake with universal services that are provided for everyone. The second layer is job guarantee for people who want to work and can't find anything else in the private sector with decent wages and benefits. And the third layer, kind of the safety net for anybody who can't work or shouldn't work, a generous income support so that nobody's left behind. So the big question is, how do we pay for it? The MMT framework is what I'm offering here for us to consider. MMT highlights the concept of monetary sovereignty, and the sovereign in the US is the federal government, not states, not municipalities. And MMT tells us that there's a spectrum of monetary sovereignty. The US is one of the countries that enjoys one of the highest degrees of monetary sovereignty in the world, like Japan, like the UK, Australia, Canada, and so on. So today I'm not going to focus on developing countries or countries that have very limited monetary sovereignty. The key features of monetary sovereignty, or a high degree of monetary sovereignty, we're talking about a federal government that issues its own currency, the dollar, taxes the public in the same national currency, the US dollar. It's the federal government that never issues debt denominated in foreign currencies. So all the national debt is denominated in US dollars and US dollars alone. And number four, the federal government doesn't fix the value of the dollar to gold or silver or any other foreign currency. So we have a floating exchange rate system, and that flexibility is very important. So we do enjoy one of the highest degrees of monetary sovereignty. Now, does that mean we have unlimited spending capacity? We should print money left and right and spend on anything? Absolutely not. And I'll give you the constraints here in a minute. So the question is, how do we pay for these national priorities without causing inflation and so on? The ultimate constraint is inflation. So the mainstream perspective tells us that we should tax somebody or borrow from somebody in order to pay for these national programs. And once you're constrained by tax revenues and borrowing capacity, you've already canceled half your national priorities because you're not going to be able to generate enough tax revenues to prepay for all of these services, which is what states and municipalities must do. But the federal government has this additional spending capacity, that bright yellow space. That's not infinite, but it's much larger than what most people think. And it's constrained by that red bar the risk of inflation is what really limits how much the federal government can spend. So the big question for us becomes, what determines the risk of inflation? And for me, it's two things. The risk of inflation is determined by, number one, the productive capacity available to us, the logistics, the supply chains constraints, all of that tells us that if we hit that limit and the government decides to spend more, then we will have inflation. The good news about this risk of inflation is that productive capacity is producible. We can hire millions of people to expand our productive capacity. And when we do that, we push the risk of inflation further and further out, and we increase that bright yellow space, and as a result have additional spending capacity. But that's only one side of the equation. The other side of the inflation risk is what I call abusive market power or price setting behavior. And here, think of your large corporations that dominate key markets in the economy. They raise prices simply because they can. Think of Wall Street, think of Big Pharma, think of your telecoms, think of price setters during the pandemic that we're seeing right now, oil and gas companies and so on. And that kind of inflation risk is not going to go away by spending less and not having Medicare for all and not having childcare for all. That risk of inflation can only be tamed and eliminated when we tax and regulate their market power out of existence. In other words, we democratize those markets, we make them more competitive, and universal healthcare is one of the key features of democratizing the healthcare system and taming and eliminating the abusive market power of pharmaceuticals and the healthcare industry in general. So once we know what to target in terms of where the lack of productive capacity is, where the abusive market power is, then we turn to our elected officials, the 535 people we sent to Washington, D.C. Their job is to spend strategically to expand productive capacity and to tax and regulate abusive market power out of existence. And now this becomes a question of democracy. Do we have a government of the people, by the people, for the people? Or do we have 535 elected officials in DC brought to you by super PACs, working for super PACs for the benefits of the price setters and the companies that dominate the system? And that's why this question of affording all of these national priorities is a question about inflation, and inflation is fundamentally a question about our productive capacity and corruption in the system. And now we can call their bluff when they say we can't afford it. So this is the paradigm shift that MMT provides for completely shifting the conversation at the national level about all the things that we can afford. So to conclude here, we're facing a systemic crisis on multiple levels. We have a climate change crisis, inequality, poverty, socioeconomic exclusion, and injustice. And all of these crises call for bold and urgent policy action. The problem is that these gradualist and incrementalist policies that we've been pursuing are too weak, too slow, too expensive, and ineffective. They don't even work, both at the state and local level and at the national level. So bolder, more radical, transformative policies are possible, desirable, and affordable. And with that, I'm happy to answer any questions via social media or some other format. And I apologize I wasn't able to join you in this event for prior commitments. Thank you very much. Have a great day.